Hello friends, today's topic is gangrene. Gangrene is a form of necrosis of a tissue with the superadded putrefaction. There are two main types of gangrene, dry gangrene and wet gangrene. Gas gangrene is a variant form of wet gangrene. Dry gangrene begins in the distal part of limbs due to ischemia. Dry gangrene is typically occur in the toes and the feet and the fingers of hand. The causes of dry gangrene are arteriosclerosis, Burger's disease, Raynaud's disease, trauma, or gut poisoning. It is usually initiated in the one of the toes, which further from the blood supply, containing so little blood that even invading a bacteria find it hard to grow in the necrosed tissue. The gangrene spread slowly upward until it reaches a point where the blood supply is adequate to keep a tissue viable. So there is a forming a line between the viable cell and the dead cell. It's called as line of demarcation. Morphologically, a dry gangrene is a dark black color which is resemble like a foot of mummy. This black color is because of a liberation of hemoglobin from the hemolyzed RBC, which is acted on hydrogen disulfide, produce a formation of black iron sulfide. The line of separation which is present between the viable cell and the dead cell brings about a complete separation with the eventual fall-off of a gangrenous tissue, or it may be a surgically removed. Histologically, over the line of separation, the inflammatory granular cells like eosinophils are present. Wet gangrene is mostly occur in the moist tissue and the organ like mouth, bowel, lung, cervix. The wet gangrene is usually develops rapidly because of blockage in vein and sometimes in blockage in the artery because of thrombosis and the embolism. The affected part is stuffed with the blood, which is favor the rapid growth of putrefactive bacteria. The toxins produced by the bacteria is absorbed, causing a profound systemic manifestations like a septicemia, which may develop a death of patient. The spread of gangrene is higher because of there is no separation between the viable cell and the dead cell. So there is lacking of line of demarcation. Bed sore is an example of a wet gangrene. Bed sore occur in the patient which is bedridden since a prolonged time, and because of this the pressure on the site like sacrum, buttock, heel can cause a necrosis with the superadded putrefaction. Diabetic food is also other example of wet gangrene, where because of a higher sugar content in the necrosed tissue, which is very favorable for the growth of bacteria and can causing a wet gangrene. Affected part of a wet gangrene is soft, swollen, putrid, rotten and dark. Other classical example of wet gangrene is a gangrene of bowel. This is most commonly caused because of strangulated hernia or intussusception. The part is thin and dark due to a mechanism that seem like a dry gangrene, where there is a coagulative necrosis with the stopping of a affected part of blood. There is ulceration of mucosa and intense inflammatory cells. The lumen of bowel contain mucus and the blood. There is no separation line between the viable cell and the dead cell. So, the spread is very higher side. May goes into a peritoneum. Gas gangrene is a special form of weight gangrene. It's caused because of gas forming bacteria like a Clostridia. Clostridia welchi is forming a gas gangrene. This Clostridia is a gram-positive bacteria which grow in the anaerobic condition, especially in absence of oxygen. It get entry into the tissue through the open contaminated wound, especially in the muscles where the oxygen is less. A complication of an operation on a colon. Colon is normally containing the Clostridium bacteria, which is very favorable condition after the operation can causing a gangrenous changes. Clostridia produce a various toxins which produce a necrosis and the edema. It produce a profound systemic manifestation like septicemia and toxemia also. Swollen, edematous, painful, crepitous because of accumulation of gas bubbles present within a tissue. Affected tissue become a dark black and smell foul. This foul smell is because of a Clostridia bacteria which goes into the putrefaction. The muscle fiber undergoes a coagulative necrosis as well as an liquefactive necrosis. A large number of gram-positive bacilli is microscopically is seen. At the periphery, there is a zone of leukocytic infiltration. Congestion and edema is also seen in this microscopically. Capillary and venous thrombi is very common. Thank you for watching. Thank you.